Hi, I'm Dr. Thomas Cheslik. I'm an orthopedic surgeon specializing in hip and knee replacement surgery. I grew up here in Northeast Ohio in the Youngstown area. I completed my undergrad education at Ohio State in Columbus and then did med school down in Dayton, where I also did my residency. After residency, I did advanced fellowship training in joint replacement, hip and knee replacement surgery down in Orlando, and recently came back here to Canton to join OrthoUnited to be closer to family and back in the state where I grew up and that I love. There's a lot of really great people here in Northeast Ohio. The type of people you interact with here, you can't find anywhere else. I chose total joint replacement surgery as my subspecialty because I really enjoy the benefit that I'm able to provide patients with hip and knee problems, particularly arthritis and other degenerative diseases or fractures involving the hip and knee. I think that the thing that I enjoy most about it is I'm able to help people get back to their daily lives and their activities, doing the things they love with less pain, which to me is really rewarding and why I do this in the first place. Most of my patients, when they come into the office, are intimidated by joint replacement surgery. It is a big surgery and it's a lot to go through, but when you get to the point where you have bad arthritis and it's affecting you every day of your life, it's a very good procedure that can relieve your pain and get you back to doing the things that you enjoy. That's really the whole goal of surgery, is to get you back to your life and get you doing the things that you love without pain. For somebody who is worried about coming in or intimidated by surgery and holding off on being evaluated for one reason or another, I like to tell people just because you're coming into a surgeon's office doesn't mean the only thing they have to offer you is surgery. There's also a wide variety of non-surgical treatment options that we can discuss and that we can try and exhaust all of those options before going down any type of surgical route. If you're worried or intimidated by surgery, that's not a reason to avoid coming in. We have two dedicated orthopedic surgery centers. The biggest benefits of these surgery centers is they're exclusively dedicated to orthopedic surgery. All of the staff, equipment, and processes are designed with the orthopedic patient in mind, and everything we do here is focused exclusively on orthopedic surgery and orthopedic care. In general, it's a better experience for the patient. After surgery, I'll see you back in the office and check and see how you're doing. We'll get you working with physical therapy to work on your strengthening, range of motion, and balance. One of the great things about OrthoUnited is we do have our own physical therapy here in the office, and they work closely with us to know exactly what type of exercises and strengthening to provide for our patients. And if there's any trouble or issues, we're able to get on top of them right away. And then once you get to the point where you no longer need us, I'll see you back probably every year or so just to check and see how you're doing. Helping people with hip and knee arthritis is helping them get back to their daily lives and the things that they love to do without pain. Pain is very limiting and debilitating, and people who are suffering from chronic pain and chronic hip or knee arthritis have a lot of difficulty getting around. Seeing them get back to doing the things that they love and be comfortable and enjoying their life is extremely rewarding and really the reason why I do this. I'm happy to be able to give back and help the people here in Northeast Ohio.